form is part of this I Promise campaign, and this is our physicians' initiative, what we do with regard to our patients.
I don't care, but I'm going to just tell you the story about, my story of being a patient and how it really gave life to patient-centered care. It was Thanksgiving. I was ill. I'd been to the hospital once because I had a high fever and chills. I had a positive flu swab. I was admitted, rehydrated, discharged. I came back a day later, a little bit worse, a little bit more tender. CAT scan showed that I had a perforated appendicitis. Really good care of me, and I had a good experience as being a patient. But during that time, I realized some of the tiny things that occurred, some of the small, tiny things that occurred that made my patient experience not so good, or forced me to think about, what I would do differently if I were in the shoes of the physician, or what I would do differently when I'm looking at a patient. So I didn't even know about the I Promise campaign, but as soon as I heard of it, I said to myself, I promise to give ice chips. And I said, the day after, you feel like you've never felt before. I've never felt that type of pain. And so rolling over to get my ice chips was so difficult. And I had this wonderful nurse, Jen. She was in the IMC, and she came in and immediately recognized that things were too far out of my reach, and she pushed the table over and put an ice chip in my mouth. And I was like, that was like the best thing I've ever felt. I was fortunate, I healed, I got better. But I think it made me a better physician to sort of be a patient and see what it's like to be on the other side, because there's a lot that, I don't think you have to be a patient to learn that, but there's a lot that I didn't know.
I think that what we learned from the patient testimonials is that satisfaction is definitely multifactorial. We can take upon ourselves as physicians what role we're going to have in terms of patient satisfaction, but some of the satisfaction that reflects upon us had to do with environmental services, had to do with food services, had to do with how dirty the room was. But it all still sort of reflects upon us, and I think that we need to kind of do our part to be aware of the whole system around us and not just our direct interaction with the patient.
A friend whose son turned out he had appendicitis. He was not experiencing much pain because he has a very high tolerance to pain. So she took him to the pediatrician. No, there's no way he can have appendicitis because he doesn't have pain. She said, I know, but he has a high level of pain. She knew her child. She didn't have a lot of Google information. She knew her child, and he did have appendicitis. Yeah. But he was not experiencing what the physician would say are the typical symptoms of having appendicitis. And so I think there's also physicians listening to the patient and what they know about themselves, because each person is different.
So if we're reliable and we're thorough and we're understanding, then we can get somewhere. And if we're not, then it's hopeless.
I would say listening, I certainly reaffirm what you've already heard, but what I would say in particular on that is particularly your lifelong kind of patients, like a CF patient. They know hospitals from the time they were born. Listen to them. They won't always follow the medical book. They know what doesn't work. And I've had different patients, sometimes the doctor insists you gotta go through this, and they did that years ago, and they know what their body does to that. Even though the medical book says this should work, it doesn't for them. So I think in particular, lifetime or long-term patients, that's the kinds you need to really listen to. I listen to any patient, but them in particular, they have a good sense of what works for their body and what doesn't. I'll share this last thought, and I think it summarizes a lot of what's been said today. One of my favorite people is Mother Teresa. I think she's a favorite of many. I like one saying she popularized, and she says, we can do no great things. We can only do little things with great love.